facelifts are another common procedure that I get asked about a lot. I'd say for me, the key to getting a good facelift is sort of having a conservative approach, which is sort of my approach to all aspects of plastic surgery. But I think by really taking a conservative approach, not really trying to get some really huge dramatic difference, I think that you can get a very nice rejuvenated appearance without looking overdone. And that's what we always want to avoid in plastic surgery, in my opinion. So I would say the best candidates for a facelift typically are people in their 40s to 60s. I do have patients a little bit older than that sometimes as well. In my experience, it really doesn't have to do as much with the chronologic age and really has to do more with just the patient's facial anatomy. There's a lot of differences in how a patient's faces change over time. We don't like our faces to change and age over time, but they do, and that's a fact of life. Patients who have, for example, been in the sun a lot more when they're younger, sometimes the skin is a little bit more damaged. There's a little bit more sagging earlier on. The patients who smoke, sometimes it can have a little bit more facial aging type of changes that you see earlier in life as well. So those are all basically differences between patients, and it really depends sort of on the examination when the surgeon sees the patient and really gets an idea of what specifically needs to be done. So let's talk about operative details. The procedure itself is usually about 3.5 to 4 hours. It really depends on the patient, like I mentioned before. And really what's done is really highly individualized. I mean, I'd say almost all plastic surgery procedures really are individualized by patient, but I would say facelift is really one where it's really very, very highly individualized. And I say that because some people have facial aging changes that are more related to here, in the jawline, really in the jowls and cheek. Some people it's more in the neck area. Some people want a little bit more lift in certain areas than others, and so there's really a lot of variation in terms of anatomy and also in terms of patient goals. So this is where it's very important to have good communication between sort of the surgeon and the patient, and that will affect specifically the maneuvers that are done during the procedure and consequently the results. There are different ways to do a facelift. My preferred method is to sort of do it in 2 layers. I'll make a small incision essentially right where the ear sort of meets the cheek, and so in that way I feel it heals very, very well and really is quite hidden from view once the scars have faded. I will extend the incision sometimes behind the ear, sort of depending on if the patient needs to have a neck lift as well. Oftentimes a facelift is combined with a neck lift, and the reason for this is because the surgical incision and axis is sort of the same. So oftentimes if you're there anyway, it's very straightforward to just do the neck lift at the same time. Once the incision is made, I'll lift up the skin to reveal some of the underlying muscle, and the muscle I will then tighten up and I put a lot of my tension sutures, or the sutures that really tighten up the facial anatomy, sort of at the muscle layer. And I've found in my experience that sort of tightening at the muscle layer really allows me to get a very nice pull without really pulling on the skin layer. And the benefit of this being that you can get a nice rejuvenation without the skin looking like it's really pulled too tight, or that it's really just been, just a little bit too drawn too tight, really. So I would say that with that, once the muscle is pulled up and sort of tightened in the right position, again, every patient being individually tailored for the operation, then the skin can be sort of put down again and then just carefully trimmed, and afterwards sutures placed. Depending on the patient, different amounts of skin are taken out. I have patients that come in saying, I would like you to take as much skin as possible, and I usually don't do that. I usually will kind of tailor that depending on sort of what I think will heal well and will give them kind of a nice rejuvenated appearance, again, without taking too much out. I mentioned earlier about the neck lift. If I do a neck lift, oftentimes I will incorporate a small incision underneath the chin. It's sort of about a 4 centimeter, maybe 5 centimeter incision, something tucked underneath so it's not conspicuous. And that just gives me access to the neck area so that I can really get some tightening of the neck as well. Let's talk about the recovery. In terms of post-operative recovery, after the operation, I do put a lot of dressings around the patient's face. I do use that to sort of tighten things up here and allow things to sort of heal in an upward position. We sort of want to, once the procedure has been done, we want the skin to sort of heal in an upward position so it doesn't quickly begin to sag right afterward. I have patients keep this on usually for the first couple of days, up to about a week, again depending on the patient. And then after that, I like them when they go home to start to wear this really as much as they can, even after that first week. A lot of the swelling and bruising is gone by about 2 weeks, but not necessarily all of it. the face does continue to improve. I would say probably from 6 weeks up to about 6 months. Things do remodel, things tighten up a little bit, swelling comes down a little further, and patients really get a really nice result when they wait after, especially after a couple of months. But they really can see the result, I'd say, really in a couple of weeks. I'll take out most sutures really about 1 week or so after the operation. And then I tend to follow patients pretty frequently afterward to make sure there are no issues with healing, make sure the scar evolves well, and that's sort of my approach to doing the facelift. And again, I think overall the takeaway message really is just to be conservative. I think that by being conservative, you can get a really nice result, and patients can look natural and be very happy, and they really don't look like they've had a facelift.